Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. This video is about salt for your babies and what is the safe limit for adding salt in your baby's diet. If you are a new parent, you may be wondering how much salt is okay to include in your baby's diet. While salt is a compound that all humans need in their diets, babies should not get too much of it because their developing kidneys are not yet able to process large amounts of it. Giving your baby too much salt over time may cause health problems such as high blood pressure. In extreme and rare cases, a baby that's had a large amount of salt may even end up in emergency room. Too much salt during infancy and childhood may also promote a lifelong preference for salty foods. Now, we'll see the reasons to limit the amount of salt in your baby's diet. A baby's kidneys are still immature and they are not able to filter out excess salt as efficiently as adult kidneys. As a result, a diet that's too rich in salt may damage a baby's kidney. And also, a salt rich diet may also affect a baby's long term health and taste preferences. Repeatedly being offered salty foods may reinforce this natural taste preference, possibly causing your child to prefer salty foods over those that are naturally less salty. As a result, babies fed a salt rich diet tend to have higher blood pressure levels during childhood and adolescence, which may increase their risk of heart disease later in life. So, how much salt is considered safe? Young babies under 6 months of age meet their daily sodium requirements from breast milk and or formula alone. Those in the age group of 7 to 12 months are able to meet their needs from breast milk or formula milk and the small amounts of sodium naturally present in unprocessed complementary foods. Most of the recommendations say that you don't add salt to your baby's food during their first 12 months. Having an occasional meal with salt added is okay. You may sometimes feed your baby some packaged or processed foods with salt added or let them try a meal from your plate. That said, overall, try not to add salt to the foods you prepare for your baby, especially below 1 year. After 1 year of age, recommendations vary slightly. For instance, the European Food Safety Authority considers 1100 mg of sodium per day, that is, about a half teaspoon of table salt, safe and adequate for children of around 1 to 3 years. Coming to the United States, recommendations for the same age group average 800 mg of sodium per day, that's about 0.4 teaspoons of table salt per day. Now, we'll see how to tell whether your baby had too much salt. If your baby eats a meal that's too salty, they may seem thirstier than usual. Typically, you won't notice the effects of a high salt diet immediately, but rather over time. In extremely rare cases, babies who have ingested large amounts of salt may develop hypernatremia and require medical attention. So, what are the ways to limit the amount of salt in your baby's diet? As a parent, you can limit the amount of salt your baby eats in several ways. If you make your own baby food, skip adding salt, choose fresh fruits, and check labels on frozen or canned vegetables and fruits to find lower sodium options. Also, remember to rinse canned foods such as beans, lentils, peas, and vegetables before adding them to purees or meals. Doing so helps reduce their sodium content. And also, check the sodium content of foods you frequently buy, such as bread, cereal, and sauces. Lower sodium versions are available for most packaged foods, and comparing labels can help you find a brand with less salt added. Frozen meals as well as takeout or restaurant foods are generally higher in salt. Occasionally, it's fine for baby to have these meals, but when dining out, a lower salt alternative would be to bring a few foods from home for your baby. Bottom line of this video is try not to add salt to your baby's food when they are under 12 months. After 1 year, you can include a small amount of salt in your child's diet. Coming to the recommendations of how much salt can be given to the children are around 1 to 3 years should eat no more than 2 grams salt a day, and around 4 to 6 years should eat no more than 3 grams salt a day. For 7 to 10 years should eat no more than 5 grams salt a day, and from 11 years and over should eat no more than 6 grams salt a day. Coming to the adults, they should not eat more than 6 grams of salt a day. That's around 1 teaspoon. This is all about salt for your babies, and I hope all parents will be careful from now on while adding salt to their diet. And thanks for watching. If you have any further queries, please do ask us in the comment section.